the idea behind ECHO is that we're moving knowledge and not people. And this is actually part of this international movement, okay? So I think it's pretty exciting. And I should also let you know that this looks like a small group here, but this group is actually going to be joining a bigger group that's already been meeting since January. So since January, we've had this group of like anywhere from like 50 to 80 people showing up, like on the fourth Wednesday of every month. And we just thought, like, we knew that other people had signed up, maybe didn't have a chance to join at that time. So we decided to go ahead and reopen the cohort, and just say, hey, other people can join on, even if it's a little bit later. But you didn't have the opportunity to get the same orientation that they all did, like when they first joined. And so we wanted to like kind of catch you up and get you up to speed as to like what ECHO is and like what some of the logistics are here. All right, so what exactly is this? So as I said, Project ECHO is this like international movement, and it started in New Mexico, and it started with a hepatologist who realized that patients were dying waiting to see him, and said, is there some way to get this life-saving expertise out into communities and into primary care so that more patients can access care faster? And that was the whole idea behind it. And they held these like virtual meetings just like this, and this was like pre-pandemic, this was many years ago. They would meet and primary care doctors from all across rural New Mexico would meet with him, and they would discuss cases. And what they found is after many months of this, these primary care doctors are actually delivering care on par with what was being offered at specialty centers for like hepatitis C, which is what they focused in on. And so that was really exciting. And since then they've moved on to many, many medical topics. And ours is clearly on pediatric mental health, but it's moved outside of medicine as well. It's gone all across the world. It's a pretty cool movement. It's all about health equity, and it's all about access. And so we're part of a big international community, and it's really about moving knowledge to people rather than forcing people to travel hundreds of miles to get access to that knowledge. A couple of main principles that I think are really important is peer learning. All teach, all learn is one of the big mantras of Project ECHO. We all have knowledge and clinical experience and insights that are important for the whole group to know, because this is case-based learning and we're going to be discussing cases. Like that active peer participation, like where we all teach and we all learn, is a really important part of what ECHO is all about. As I said, it's case-based learning. So we're all taking turns, or many of us, maybe not all of us, are taking turns bringing cases to discuss during that lunch hour. So we're managing real patients and we're doing it collaboratively. So don't feel like it's a teaching case where you're the teacher and it should be wrapped up in a bow and we have all the answers. That's not it at all. We're bringing our cases in real time, like asking each other, help, what do we do? And don't feel like you've got to like bring like super complicated ones, although those are welcome also. Simple questions are also welcome, because chances are many others in this group are wrestling with the same questions. So case-based learning. And the last is community. So we are on Zoom, we're coming from all over, but we want to have some trust and some community in discussing some of the cases that keep us up at night, frankly, that have us worried, so that we're not carrying that burden by ourselves. And that's part of our hope, is that we can create, even in this virtual space, some sense of community that we're in this together. Any questions about the ECHO model overall before I kind of go into some of our Project ECHO goals? And Lauren, I see your message that you've got to step off in a couple minutes. Thanks for showing up and introducing yourself. So please feel free to step off when you need to. All right, so if there are no questions about the ECHO model, and feel free to jump in and interrupt anytime you need to. This is what we're hoping to achieve in our ECHO. Because as we know, pediatric mental health is this like exploding area of need. and we're all dealing with it, and we're all seeing patients with these needs. And so we're hoping to boost our collective confidence and knowledge and skills in diagnosing and managing common mental health conditions in children. So can we recognize these? Can we diagnose these? And can we take the first steps in managing these, and many times managing them on our own? Gaining some new tools, including some like measurement and screening instruments, knowing what's in our wheelhouse, or it could be in our wheelhouse, and knowing what's not. And we're also hoping that by learning together and by coming into community, we might actually have fewer deflated rubber ducky days and reduce some of our burnout. These are some of our topics, and this is the order in which they're going to be coming. So in 2 weeks, we're going to be having like our meeting on topic on suicidality. And then we go on to disruptive behavior, early childhood mental health, autism spectrum, adolescent substance abuse, PTSD and trauma, and that takes us through December. At that point, the big group is all done with their, echo. But we're going to go ahead and continue and on into discussing assessment, sleep, depression, ADHD, anxiety, SSRIs. These are the topics that the larger group has already gone over during these last 6 months. But we'll have a chance to continue on as an echo and talk about these topics too. Plus anybody else who joins us between now and the end of the year. Okay, this is what the typical echo session is going to look like. So congratulations, you figured out Zoom. And we're going to Zoom into the same link at the same time, the 4th Wednesday of every month at 12. We'll have a brief period of announcements and check-in. We're going to have a brief didactic session that lasts about 20 minutes. Okay, and so that starts us out. That will also be recorded. Okay, so if you're running late from clinic, never fear, right? You can always go back and look at the recording later. The heart of the echo is really this case-based learning and consultation, and that happens from like 12:30 to almost 1 o'clock. Okay, and we take turns sharing cases. And participants can present real de-identified cases. Okay, so please, no HIPAA information there. And then we'll be talking about these cases as a group among our peers as pediatricians. And we have our subject matter experts, and those are child and adolescent psychiatrists like Lauren and like some others who are going to be part of our learning community, who are there to lend their expertise to our case discussion as well. And this part's super important for the logistics. If you want to get CME credit, stay on until the 5 minutes before. We put on like this QR code, okay? And we also cut and paste that link into the chat. That lets you check into our CME portal and gives you credit in our CME portal that you showed up that day. And then you can get that 1 hour of CME credit, okay? And then that takes us to the 1 o'clock hour. Now, if you don't have afternoon clinic, you're welcome to stay for an optional extra 10-15 minutes where we have Q&A time. And that's just a little bit of extra time, like at least one of our psychiatrists stays on. If you want to, if there's more stuff that came up from the case that you just like want to talk about, you can talk about that. If you got your own patient question that's just like is burning, you can bring that up, right? It's like a less formal, almost like brown bag lunchtime, where we just like have a chance to talk to each other and talk to psychiatrists more about like stuff that came up, like either from the lecture or from the case discussion, or even just from our recent practice. So any questions about like how the echo session is run, about some of these nuts and bolts?
Is the, this is Allison, is the case-based learning and consultation where we bring up cases, is that a standardized formal thing, or is that an off the top of your head kind of discussion?
Somewhere in between. So I do send out the survey link that lets you get some of the information and type it out. Okay. And that just helps you to organize your presentation on the day of, right? So that it's easy to like summarize it in like 5 minutes, right? So all the details are like right there at your fingertips. I give you the survey link in RedCap after you sign up. After you fill it out, at the very end, it says, it gives you the option to download the PDF. Please download the PDF and save it, print it, have it available, so you have it just for your reference. So it's like much easier just to summarize the case on the day of. Yeah, that's a great question. Other questions about some of these nuts and bolts? As I mentioned, it's going to be fourth Wednesday of every month from 12 to 1 p.m. It's going to be lasting for 12 months. You are going to get CME credit, AMA Category 1 CME credit. It's eligible for MOC Part 2 credit as well. We can get up to 12 hours, and of course, the amount of credit you get depends on how many times you attend, right? And like scan that QR code. The case discussions, we have been trying to do breakout rooms like in Zoom, right? So that we have smaller groups, so that we have more than one case going at one time. We have had some technical difficulties with the breakout rooms, but we're going to try again to have like more than one breakout room so that like we can have more than one case and then more people have a chance to share. And I want to add that like the MOC Part 2, like we've made it contingent on doing a pre-test, doing a post-test, okay? Now, if you share a case, you don't have to do that post-test. You don't have to do it, okay? Because, you know, you've had like that case discussion and that evidence that you've been this really active participant in it is enough for you to get that MOC Part 2. So I just wanted to let you know that's a little bit of a carrot out there for sharing a case, okay? And so, yeah, just prep, as we said before, just prep a brief summary and like 1 to 2 main questions you really want to discuss that would help you. Like, it's like, this is really what I want to know. Please don't include PHI in this. And there's no such thing as a dumb question, right? One of our first ECHO participants said, I feel like an intern again. And she was a 20-year veteran in pediatrics, right? And it's not a comfortable feeling. And it's hard. But the thing is, we are in this together and we've all been there. And so there is no such thing as a dumb question. So these don't need to come wrapped up in pretty bows. They don't need to be polished. It's really about sharing with each other and learning from each other. So I know that life happens, clinic happens, vacations happen, etc. But to the extent that we can attend regularly, it's wonderful in terms of building up that community and that learning. It's wonderful to be able to have that camera on and people eating during this time is fully expected because it's over the lunch hour. This is the virtual brown bag meeting, right? So like what we'd love to be able to see each other. That really helps to build the community because we're learning from each other too, and not just our psychiatrists. If you want to share a case, please do fill in that case survey at least 1 week before. And what that does is it gives our staff a chance to scrub any PHI out of the summary. And it gives our subject matter experts a case to take a look at it. And, you know, and they often like to prepare because it just like helps them to be all the more valuable. And yeah, as I mentioned, the authenticity and supportive environment, that's really what this is about. We are not here to impress each other. We're okay, any questions again, like about some of these nuts and bolts, expectations, etc. Okay. So this is kind of like a sample of like what a case might look like. The brief ID, right? And then the question. And then just like the brief history of present illness, some of the background medical history and relevant family history. is what we are going to be sharing in the case presentation. And this is the red cap link, but I will be sending that out through a calendar invite, like for anybody who wants to share a case. Okay. And while I've got you here, we do want the cases to link to the topic because it just makes learning that much better. Do any of you have any interest in sharing a case on these upcoming topics? You know, I know it's a little bit early for the suicidality one, but like disruptive behavior, early childhood mental health, any of these.
If I can get it, this is Jean from Pacific Pediatrics. A bunch of our teenagers this summer have had a lot of suicidality. It's all mixed into eating disorder too, and I get very mixed up with whether it's the anxiety, depression mixed causing it versus the eating disorder. So if I might have something to submit for that.
Okay. Let me see if there's
if there's no space, then I might not even get to it anyway.
Yeah. Let me see if there's room and I'll get back to you on the suicidality one, but I think we could probably slide that into. There might be an aspect of depression in that, right?
Yeah.
And so maybe we could slide it into that time as well, maybe as a backup. Okay. All right. Fantastic. Anybody else like where it's like, oh yeah, I have a case that's really about this. Who'd like to share a case? Okay. You can also let me know later, you know, like each month, like we solicit like for the following like month or two as well. So you can also let me know later if the case comes up and you say, oh, I really want to share this. Okay. Okay. I also wanted to ask you guys, like, because we had some technical snafus, right, with the registration process. How did you hear about this opportunity to enroll into ECHO?
I had the advantage of Jean telling me. I don't know where Jean got it from.
I got it through one of the CAPP emails.
Okay, so CAPP email.
Mine was a CAPP email as well.
Okay.
Yeah, email for me too.
And did you have problems registering? Did anybody run into registration problems at all when you tried to register?
It seemed like it worked the first 2 times, but I didn't start getting emails about this until I'd done the 3rd time.
Okay. Okay. So that's, thank you for doing it all 3 times. My goodness, I'm sorry. We had to transfer which system we did the registration off of. So that's what happened. But I think what happened is that the Zoom registration gave you the Zoom information, but we didn't know who was registering. The Zoom was not giving us that registration information. That's why we had to ask you to do it again. So thank you for being persistent. I do appreciate that. Did everybody, like when you got the registration, did you get not just the registration survey, but also the MOC Part 2 pretest and other surveys? Did you all get that? Okay, great. Fantastic. So that's required for like that information we need in order to get like MOC Part 2 credit for you guys, you know, to report to the American Board of Pediatrics for those like who are part of the American Board of Pediatrics, to basically also to give to our funders because they also require certain information. So some is for our CME accreditation board, some is for our funders, right? Some is for our own evaluation, but mostly it's for those first 2 purposes. And then MOC Part 2, like we need like some evidence of like meaningful like learning and practice change, which is why comment like either case discussion or like the pre and post test showing, you know, like some greater mastery of the material is how we prove that part of it and could get MOC Part 2 credit. Once you set this up, you should automatically get monthly surveys asking you to give us a little feedback. If you have the moment, that'd be great. Like it helps us to improve what we're doing. And we do look at that. Okay. So everybody like who signs up, you should be eligible for CME at the minimum. Pediatricians, we have it set up with American Board of Pediatrics for MOC Part 2. If you're in family practice, we do not have AAFP MOC designation. So if you're in family practice, we can't do the MOC Part 2 for you, but we can do the Part 1 CME. But we also have an optional MOC Part 4 activity. It's a QI activity that has to do with depression screening and response. So what we do is we send a survey to you and we ask you to review the last 10 adolescent well-child visits that you've done. And then you ask it like up to 3 or 4 questions about each of those visits. So you pull up your last 10 adolescent well-child visits, look at that note and answer a few questions. And the first one is, was structured depression screening done at this visit? And then was depression like diagnosed? Okay, so you have to answer those like for all of those. And then the other questions like depend on like what your responses are to the first 2 questions. So it shouldn't take too long. I think the hardest part is actually identifying. Hopefully if there's identifying those last 10 visits, hopefully there's an easy way to do it. I personally went through like my schedules for the last couple of weeks. And I said, I know that was a team. I just clicked those open, right? It's just like the last 10 that I could identify. But yeah, that is optional. So you don't have to do it. But what happens is that we gather all this data and at the end, I collate the data as a group and I submit it to UCSF. And I've already run the activity by them, all our measures and that stuff. And they said, you should have no problem getting like MOC Part 4 credit for this. But each time, each cohort, I have to submit, right? Here's all the data for this group and here are the people who participated. And that should give you the MOC Part 4.
Do we have to sign up separately for that?
It is a separate sign up and a separate survey. So that should be going out today or tomorrow, like whenever we get to it.
That'd be amazing.
Whenever we get like that registration, like, you should, since you all got that first one and we have your emails, like we know who to send this to. So we'll be sending this out also. Okay. So again, all of this is de-identified. We don't want to know their names or anything that lets us identify who they are. And we only use aggregate data to report on how are we doing as we participate in ECHO, right? Come to these sessions, discuss cases. Does that improve our ability to identify depression, screen, and then follow up? Because the other questions have to do with, do we have a follow-up plan? Right? And does that follow-up plan include like medication or what elements, right? And so we want to just track for ourselves. There's our ability to do that go up. And the quality improvement activities, are either I've shown up at ECHO and or I've attended like a different CME activity and or I've called CAPP about a case, right? Or other. And there's another category where you can like fill in the blank, whatever else that you've chosen to do for yourself to facilitate the flow within your clinic, etc. So you can fill in other as like, this is my quality improvement activity, and let's see if that improves my performance. Okay, but we set it up so hopefully it's easy. All right, so these are the next steps right here. Any questions about these? Because this is the really important stuff to make sure that we have all the information we need to give you the credit and to give you all the credit that you might be eligible for. And so not everybody who registered was able to show up today. I think this, this is not always, it was short notice. And so not everyone was able to show up. So we are going to post this recording minus everybody's check-in. So we'll start from like when I started this PowerPoint portion here. And just let them know that will be on our website. And they can look at that just to get the nuts and bolts of this. before our first session in 2 weeks. So with that, oh yeah, here's the MOC Part 4 activity that I already talked about. Oh yeah, and I forgot to mention, it's every 3 months that these surveys will be coming out. Okay, so baseline and every 3 months. And who we are. I think mostly we've introduced ourselves to you. Dr. Wang will also be like one of our core hub team, and she's another child and adolescent psychiatrist. Sometimes you'll also see Dr. Petra Steinbushel, who's often frequently on as a subject matter expert, as well as some of our other CAPP consultants will come on at times. And so with that, I want to leave open for questions.